Hi, everyone. I'm Vicki Janowski, editor of the Greater Wilmington Business Journal. And thanks for joining us for this week's Wilmington Biz Talk. Today, we're going to be discussing the county's mask rules that are going into effect tomorrow. And joining us today are David Howard, who is the Public Health Director for New Hanover County, and Kim Thrasher Horne, who is Vice Chair of the Health and Human Services Board for the county. So we'll talk with them a little bit about what the rule changes are for tomorrow for New Hanover County, how it came about, and what they are going to be tracking moving forward. But first, before we kick things off, we're going to hear a short word from our sponsor, Cape Fear Realtors.
Hello, I'm Ann Gardner, CEO of Cape Fear Realtors. Realtors support this program's efforts to connect our community in meaningful dialogue with actionable insights. Realtors are dedicated professionals who build strong, resilient communities and businesses. Work with someone you can trust. Work with a realtor. Learn more at capefear.realtor.
Earlier this week, New Hanover County Health and Human Services Board voted unanimously to start the rule process for having mandatory masking in indoor public settings. Now, for reasons that we'll get to in just a minute, there is actually a public comment period that lasts for 10 days. However, indoor face coverings will become mandatory starting tomorrow at 5 p.m. So to talk a little bit about this, how it came about and why it's coming about, we have our guest panel today, which includes David Howard, the Public Health Director for the county, and Kim Thrasher Horne, who sits on that Health and Human Services Board and is Vice Chair. So just to start us off a little bit broadly, and meanwhile, as always, I'll be keeping an eye on the Facebook feed if you have any questions you want passed along. But tell us a little bit about that vote this week and what it means in terms of residents or people who are visiting in New Hanover County.
So I'll start off. The vote was mainly to consider the rule. By law, a rule, public health rule, has to be provided to the public for a minimum of 10 calendar days. So it's published. We publish it electronically, but also the legal notice goes in the paper, which is going to go in tomorrow, Friday. And then another meeting happens and a vote happens. The rule itself is very, very similar to what we had previously in terms of using cloth face coverings widely across the public. This differs a little bit because it's a little less broad. It's only for indoor places where the public is either invited or allowed to be, including private settings where we can talk about the word public, but the rule itself is one tool that public health uses to protect the public health from imminent dangers. And then we can talk about the abatement order that I issued that goes into effect tomorrow at 5 p.m. They're essentially the same requirement. Any public place, we're requiring face coverings. The reasoning, first of all, immediacy. We have been in conversations with our hospital for a year and a half. Currently, locally, your healthcare system is in trouble. They've seen an increase over the past 6-7 weeks from one patient in the hospital to almost 120. A lot of them in ICU, and it's not just the physical space shortage. They're struggling with staffing, both sheer numbers of staffing, repeating shifts, but also fatigue. And so this abatement order, in effect Friday, is requiring the same thing, face coverings in indoor settings. It's published and it's pretty straightforward, really. But the intent is simply to add that layer on a more broad basis. Now, you'll remember the governor dropped his executive order on July 31st that required mask or face coverings. But the follow-up executive order said it should still remain in place because of we haven't reached the goal line beating COVID, and also the Delta variant was on the way. It had already hit some of our surrounding counties pretty hard, and it's here now. The sequencing the state CDC has done for us shows that anywhere from 80 to 90% of the cases are likely Delta variant cases. The spike the spike in cases, the spike in hospitalizations is putting a real, putting us in a danger spot with our healthcare system. And just to wrap up, one of my obligations and duties, and one of the obligations of public health locally, is to assure health services for the community. When our main regional medical center is stressed to their limits, that compromises healthcare for everyone. So ED visits, car crashes, heart attacks, strokes, all those things have to go to the same place that's filling up with COVID patients. That stresses our system. We need to flatten that curve. And I know we didn't want to hear that phrase again, right, from last year, but it's the same goal. We need to give them some relief and give our health systems some relief and give some relief to the population as a whole in terms of the threat. The Delta variant is seeing more younger people. The average age now in the hospital is in their 40s. Dr. Paul mentioned in some publications recently that they have anywhere between 4 and 10 people in their PICU, the pediatric intensive care unit. So this is not just hitting old people anymore. So that's the goal. We simply want cooperation for the face coverings around the community. That will help. They're not perfect. They don't do the job completely. They work in tandem with the vaccinations and distancing and cleanliness and hygiene. So it's a layering approach.
And Kim, so David, you just mentioned some of the restrictions that were in place last year, and that was under a statewide rule that came from the governor's office. What we're seeing now this week is people are responding to community responses to that increase that you're talking about with the Delta variant are very differing rules, particularly when it comes to face coverings. I know even in Wake County, the individual cities there have differing rules about what they expect people to be doing going forward in terms of masking or not inside. So Kim, can you just kind of share some insight a little bit about what the board was thinking in terms of why to make this action now and move forward with it? And also, were you guys looking at what other municipalities were doing around the state too?
Yes, I'd be happy to comment on that. Thank you. If I can remember both questions. First of all, the alarming rate of our hospitalization rate was very first and foremost in our decision making. We had the Dr. Paul, the chief clinical officer, or director rather, speak of the number of hospitalizations. And when we started that meeting Tuesday, it was 112. By the time we ended, it was 114. So that's a patient an hour. It's the rate of hospitalizations is just simply alarming. And we felt it imperative. Timing was of the essence to help fulfill our mission as a Board of Health and Human Services to protect our community, the health of our community, the health of our citizens. So that was the timing. I think we didn't turn a blind eye to what other counties and municipalities were doing, certainly not. So that was in essence a way that we were being supportive with or supported with our decision locally, but we're looking locally at our citizens and what our citizens need. And we're trying to do what we can to provide them with the highest level of health.
So could you walk us through then, so once this goes into effect, as David, as you're mentioning, the abatement order starting tomorrow, or if the health board actually approves that same rule officially in a couple of weeks, what is it that business owners need to know when it comes to their employees coming into the office, customers coming into their store, or other scenarios of people who are responsible for these public places? What's the responsibility on them?
So officially, technically, the responsibility is to assure as best they can the use of face coverings by all staff, visitors, contractors, et cetera, in indoor spaces. So if you are, and we've had this question, if you're in a semi-open building, like on a construction site, there's no windows or doors in the building, and they may actually be in a little bit of a danger to use face covering. that's fine. But if you're in a typical indoor setting, the obligation under the rule and under the abatement order that goes into effect tomorrow is to have everyone use a face covering while indoors over the nose and mouth. The expectation is that we come together and cooperate and do this for as long as necessary. The hope is that this is only for a relatively short period of time. We all know we do a lot of reading. The Delta variant burns very quickly, so to speak. It has risen extremely fast. As Kim pointed out, the alarming rate of increase is steeper than it was last January before we had vaccines. And we have a little over half of our population fully vaccinated. And we've also learned that the Delta variant is pretty good at infecting people fully vaccinated and possibly transmitting. It's to a much lesser extent than unvaccinated people, but it could happen. So the use of a face covering indoors can be effective. It's not 100% effective, but it's a layered approach and it helps. So that's the obligation. The potential, what we want to do is educate if business owners are struggling, as they did last year with some compliance issues with customers, what have you. We're happy to give them tips on how to communicate with customers. We don't want anyone's operations to be hurt in any way by this, but we do want to help everyone understand that this is not a long-term thing, we hope. So maybe we're looking at 4 to 6 weeks. We're going to be driven by the metrics, though. When we see the hospitalizations dropping, hopefully as fast as they rose, and we see the percent positive from the testing pool that we see, we're well above 10%, whereas we were under 2% just 6 weeks ago. That's the dramatic rise. And we know that not everybody sees this in their everyday life. Not everybody sees this in their business every day. But behind the scenes, what's going on behind those walls of the hospital, what's going on behind the scenes of families with someone in the hospital on a ventilator, possibly not going to make it. That's what we have to concern ourselves along with everyone else. And that's the reasoning for the action.
Well, you mentioned those metrics and how long these rules might be around and keeping an eye on the numbers and if they go down. So that leads into a question from one of our readers who posted, can you explain why the previous mask mandates did not flatten this curve? Do you feel like that was accurate, or did you see an impact last year?
So the previous mask mandates were effective, but we had so much more going on. We had limited activity and we were pre-vaccination. So we're in a new world now. As I said, we've never been under the illusion that a cloth face covering available on the retail basis is not perfect, but it helps. We do fit testing and training for our responsibility to other types of emergencies with N95s and other type masks that have to be fit tested and properly fitted. And the cloth face covering, for instance, is not appropriate for healthcare personnel. It's a realistic approach to limiting some of the spread of the virus with much more comfortable cloth face coverings. So there's an effectiveness of the face covering, but they're not the be all end all for sure. Not even close. We're not going to mandate vaccine, but that is the answer. If back in April, May, June, we had kept pace with the vaccines, and I can say this with absolute confidence, and I hope Kim can as well. If we had kept that pace with the vaccinations going, and by July 4th, say, we were at 80% vaccination across the community, we would not be here. We would not be seeing the spike in cases. We would not be seeing the hospital overrun with patients seriously ill and in intensive care. It just would not be happening. So we encourage people now for the short term to use the face coverings to basically beat back the surge in the short term. And then also seek out the vaccine, get yourself fully vaccinated so that in the long term, we keep the virus at bay.
And I would just concur and agree with everything that David has said and add that, yes, the evidence on face coverings or face masks may not be described as conclusive, again, because there's a lot of things that went into different studies. However, overall, the information does tell us that this face masks decrease the inoculum or the volume of the virus particles that get out into the air. And when we're talking about indoor transmission, last year we were talking about if someone was infected with the virus, they might transmit that to 2 people. Now we're talking about 5 to 8 people is what some of the data say, by 1 person. And the masks can help minimize that volume of viral particles that get out into the air. And with that, hopefully lessen or make the disease mild if a person does become infected with the virus. So there's a lot of parts that contributed to this decision.
And then another question or area that's come up since Tuesday is some people are asking about enforcement. How do you actually enforce this kind of policy or order? David, you mentioned earlier about compliance questions that came up last year from stores and businesses. And I think it's very safe to say that that's just grown over the past year in terms of people's feelings about wearing masks and not wearing masks, particularly after there was a brief period of time where people no longer had to wear masks inside. So I think it's going to be safe to say it's going to be even more challenging for store owners and business owners to try to have customers follow the rules as the order's been laid out. So what was the discussion like on how to actually enforce this new change?
Right. So, and that's always tricky. Public health is given the authority to use sparingly, only when absolutely necessary. So we want to assure the community, especially business owners, that we did not come to this lightly. And again, as I said, the intent is to act quickly to hopefully push back the rapid rise of the virus so that we can drop this requirement as soon as possible, as soon as those metrics drop to safe levels. The power and authority to mandate anything on a public health focus is there for purpose to protect the public. And that's the only reason we're using it. It's not really for us about the mask. And I don't think for most people it's about the mask itself. We don't like to wear them. I don't like to wear them. I'm not wearing one now because I'm protected inside a private office. And I enjoyed not wearing it for several months. But we're back to it because of the metrics, because of the science of this virus, and the fact that the virus doesn't care about whether or not we want to wear a mask or want to get vaccinated or want to do something or don't want to do something. Unfortunately, we have to follow that evidence. The technical remedy for violation of a public health rule or order to abate is in the statute 138-25 is a misdemeanor. So there are legal consequences. That is not our intent. I can't remember ever in my career actually doing that, except in the case of 1 or 2 individuals. And this actually happens more than people realize. Seriously communicable diseases are handled by us week in and week out. But it's usually on an individual basis behind the scenes. So an HIV positive person who's a food worker, or a TB patient who's non-compliant with their medications that we have to directly observe them taking. That's usually behind the scenes. This just happens to be a very broad-based threat. So we're doing really the same thing that we do week in and week out, issuing orders to a person who's non-compliant. We had the executive order in place until the end of July. We had, loosening compliance, we'll say, right, throughout June and July because things were getting better. And then it exploded when Delta arrived to North Carolina. And so we had hoped that people would make a good choice. And we see some people in public still using a face covering, mostly to protect themselves, perhaps. They have something going on and they need to protect themselves if there's any risk at all. the real push for us is education. And I know this sounds much easier to say than to execute in various types of businesses, but try to make it as positive as possible. If your staff is using a face covering and if you're taking precautions, set the tone, set the standard. Let's all pull together and push back on this and push it back to where we can get back to normal again. Again, I'll reiterate, if in the short term, we use the face coverings and other mitigation measures, and everyone puts on the top of their priority list to go ahead and get vaccinated, then that will help us into the fall and into the holidays. We do not want to have another holiday season like we had last year. The vaccination will fix that.
We do have someone pointing out that the proposed rules, or the abatement order as it's written, does have a list of exemptions. But the question is, if businesses are not allowed to ask a customer who's not wearing a mask what exemption they fall under, how do they control their customers and avoid the penalties?
Right. One of the most effective ways that businesses used last year was to have some of the paper mask available. I went out this weekend to a large retail store, and the staff was using masks, and they had them available, boxes of the paper mask, and that makes it a passive reminder that it's the best thing to do, and the store owner is encouraging that. So I would suggest that they're readily available now, not terribly expensive. So that's probably the best approach. And you're right, we don't want people inquiring with their customers about their particular condition or reason, but you can certainly remind them you have the mask available free of charge. You're free to use it while you're in the store and take it with you when you leave if you'd like one. And every person who goes along with that will help a little bit, because one of the really challenging things about this virus is we can't see it. We don't know when someone has it. Not everybody is made ill. So, in other words, with a cold or something else, typically you have symptoms and you're sick. With this virus, interestingly enough, not everyone even knows they have it, but they can still pass it on, and that's the big reason behind the mask.
One area I did want to bring up, because there's a change from last year's executive order from the state. Again, we were talking about the statewide orders on masking that was in place, is the minimum age groups that we're talking about. Last year, it was supposed to cover children who are 5 years and older. I notice in New Hanover County's rule, and also in some other parts of the state as well, on those ones that are being passed this week and last week, it covers children 2 years of age and up. So I'm curious about why the age change, and then also, that includes a whole different pool of people that didn't have to necessarily implement it with small children, such as like daycare facilities and childcare settings. So can you address that a little bit, the age change, and also what the outreach is then going to be like for childcare?
I'll just give a clarification, and then Kim might be able to add a little bit of science behind this. In the rule and in the abatement order, there's a list of the exceptions. One of those exceptions is for children 5 years or older, where the parent or guardian just cannot maintain a mask on the child. They're just repeatedly taking it off. The guidance from CDC is that any child of two or above should use their face covering, because they can carry and transmit the virus. They've learned that through research over time. Also, as Dr. Paul mentioned, children seem to be catching the Delta variant and being impacted more so. So any protection we can offer them, especially if they're in an indoor setting for a relatively short period of time, if they are using a face covering, hopefully they'll be somewhat protected. And I'll let Kim chime in on that as well.
I just agree that, again, this is a different time and a different variant than what we saw a year ago. And we're trying to adapt with how the virus is changing on us and how it's presenting to us as a community. And so, that's all that I would add to what you had to say, David.
Then a question on another scenario. So New Hanover County Schools had already previously approved extending masks for students when they return back to school next week on the year-round calendar schools. But that rule, what the school board passed, does not cover private schools and private school classrooms. Does this county rule now cover private schools?
It does. If they're in an indoor setting, it
Okay.
does.
Okay. How about before we run out of time, I'm curious, so far, it's just been a couple days and I know public comment period is starting as well, but what questions have you guys been getting the most this week in response to the change?
So the themes are lack of confidence in the effectiveness of face coverings. And that's why earlier we fully acknowledge that a cloth face covering, as opposed to a properly fit tested N95, for instance, is not as effective as a fitted N95. We acknowledge that because we know that, we've known that for a long time. The reality is not everyone has access, or we're not going to require everyone to walk around every day with an N95 on. They're pretty uncomfortable, and we have to deal with reality as well. The cloth face covering, especially if it has a couple of layers, as Kim pointed out earlier, it catches some of the virus, either passing out from a person or in the airstream, protecting the person wearing the mask. Primarily, though, it's designed to prevent at least some of the virus escaping a person and possibly transmitting to someone else. So it's a numbers game. We're just trying to throw down barriers to the virus and have it transmit less. The other theme is sort of freedom of choice, which is fine. We support that. I want everyone to understand and know that we don't, our intent is not to limit freedom of choice or movement or activity or business or anything like that. Our focus is solely on the virus and the impacts on the health of the community and our health system, as we talked about earlier. And that's it. We wish we had another mechanism. We wish we had some way to see this virus and know exactly who has it. There really isn't the testing volume to quickly know. You have to wait 3, 4, 5 days before you have enough viral load to even know that you caught it if you've been exposed to someone. That's just the way viruses work, unfortunately. So the face coverings is just a relatively simple and relatively effective way to interrupt some of the transmission so that we can give some relief to our health system and to the community and those most vulnerable. We have a lot of people in the community who were in cancer treatment, in taking medications that intentionally suppress their immune system. And they're walking around among us, working with us, in the store with us. They don't wear a sign, but they are at great risk of serious illness and death from this virus because of that. And we need to think about them as well.
Okay, I want to thank both of you for spending your lunch hour with us and going over some more details about that abatement order. And like I mentioned, the proposed health rule. We'll have coverage of this discussion today in our 4 o'clock email, and we'll include links to some of that information that we talked about on here. I want to thank all of you for joining and viewing in. If you want to catch up on previous Wilmington Biz Talks, you can go to WilmingtonBizTalk.com or check us out on your favorite streaming platform. Thanks very much, and we will see you here next week.
Thank you.
Thank you, Vicki.